Designed specifically for women, the Mission Hospital Women's Wellness Center Heart Health Program is committed to the prevention and treatment of heart disease, the #1 killer of women in the United States. We spoke with cardiovascular nurse practitioner Peggy Kirkwood about what the heart health services provide.
We have in the Mission Women's Wellness Center, a portion of that is a women's heart health program. And our heart health program, in the Women's Wellness Center, we wanted to look at all aspects of women's health, and we couldn't not look at the heart health as well, in that whole scheme of things. Women in heart disease is a big push now. We're really looking at how to keep people healthy and how to prevent that heart disease. And our program is actually a preventative program. It's a risk profile. For $75, people can come to our center and they can get a lipid profile blood draw and a glucose screen, which is to look at diabetes. They can get an EKG, and they get a risk profile form that they fill out, which goes into a little computer database and spits us out a nice little report that tells what your risk is of getting heart disease. 1 in 3 women will die of heart disease, and that is a myth that's out there, that heart disease does not hit women. It is something that we've been, the American Heart Association and the Heart Association, different heart associations, have been trying to get together and have this red dress campaign. I don't know if you've heard about that, especially during February, which is Heart Month. And there's a big push now for the red dress campaign, which is an awareness of women with heart disease and the dangers of heart disease in women, and how many women actually do die of heart disease and get heart disease and get treated for it. Women show up with heart disease a little different than men do, and so our diagnosis of heart disease in women is a little bit different. Our treatment in women is a little bit different. The sad part is that many of the research studies that have been done up until 10 or 15 years ago, the majority of them were men that were in the research studies. So we always thought, well, what's good for men works for women, and that's not necessarily the case, that we've been treating women the same way.
We asked Peggy Kirkwood, what are the symptoms of heart disease in women?
The symptoms of heart disease in women actually show up a little bit different than men. We don't usually have that Hollywood heart attack, that's a strong chest pain in the middle of the chest going down the left side and you fall over. We do have those also, but not as frequently as men do. Women's heart disease symptoms show up a little bit different. We may have shortness of breath. We may have back pain. We may have, I have one patient who has wrist pain, and she's had 2 heart attacks, and that was her symptom from that. We may just have fatigue, and these are symptoms that are not real distinct, so they're hard to say, oh yeah, I'm having a heart attack, I need to go to the hospital. So that's why a lot of times the diagnosis of heart disease in women is set aside or missed, because those symptoms can be a little vague. Our program is unique for a couple of reasons. First, we have in the Women's Wellness Center, we have a nurse navigator, and that nurse navigator meets most of the women that come through the center, and she can help people with whatever aspect of their health care that they need some help with, heart being one of them. And she can identify those patients and kind of farm them into our program. I'm not sure that every women's center has a nurse navigator, so I think that is a unique aspect of our Women's Wellness Center. As well, to have that women's heart health program incorporated into the Women's Center. I'm not sure every women's center has that heart health program in there. There are many heart health programs out there. They may be separate from the Women's Health Center. So to have that all incorporated into the Women's Wellness Center is pretty unique. The Women's Heart Center is staffed, there are 2 of us right now that work there. I'm a cardiovascular nurse practitioner. I'm the program director and coordinator. And then I have a cardiovascular nurse that used to work in an intensive care unit who actually sees the patients and does a lot of the counseling with them. So between the 2 of us, we kind of share the meetings with the people and sharing the information with them. Heart disease is one of those diseases that we need to prevent 20 or 30 years before the symptoms actually show up. So to catch these women at a younger age and at a time when they can make those lifestyle changes to help prevent the heart disease, we feel that that's very important for this particular disease.